Hi everybody. Um, so we've all probably heard of the show Grey's Anatomy or any other medical show. And I have to say I'm a Grey's Anatomy fan, but working in the OR, and I've been in the OR for about 2 years now, a lot of the stuff they do on Grey's Anatomy is not the correct way. They do it for TV, but it isn't right. So, today I'm going to talk about one thing that drives me bonkers from this TV show. And it's one of the very first things they teach you as a new nurse, a new scrub tech, or even a new resident or medical student coming into the OR. And that's how to sterilely gown and glove yourself. This is a very important skill to know how to do, because in the OR it's a very sterile environment, because we want to ensure that our patients do not run the risk of getting an infection. So one of the first things you have to do when you're going to come into the OR is you have to go through a skills check-off. I had to do this. I was so nervous about it. And it's funny because you think it's such a simple task, but there's a lot that goes into it. And if you do it wrong, you run the risk of your patient getting infected. So the first thing you have to do when you are going to get ready to sterilely gown and glove yourself is you have to have your equipment ready. So I borrowed these from work. We have a pair of sterile gloves. They come in this sterilely sealed packet. And then I have a sterile gown. Usually this is wrapped in a package as well, but this I can touch because this outside of each of these is not sterile. But inside these packets, once I open them, they're considered sterile, and I cannot touch them with my hands as they are now because I haven't done a sterile scrub. So the first part of sterilely gowning and gloving yourself is opening your gown and your gloves using sterile technique. So, as you can see, the package is folded, and the first part of sterilely opening your gown is to take the flap. There's a little flap right here, and you're going to open that away from you. Next, we have another flap, and you're going to, I'm just showing you right now, but this isn't normally how you do it. You would open it away, and then there's another flap here. You open that away, and then there's one more flap that you're going to open towards yourself. So now, this whole area, wherever the blue is now sterile. So I cannot touch that with my bare hands. Now I'm going to open my gloves, and there's a little perforation at the top. So I'm going to pull it apart. Now I remember I cannot touch these, so I'm going to carefully drop them onto my gown, ensuring that sterility is maintained. So this is how I would have my gown and gloves before I come in to scrub for procedure. Now the next step I would have to do is go and complete my 5-minute sterile scrub. And with that, I make sure that I scrub all the planes of my hands and arms, starting with each of my fingers, each side of my hand. Usually they teach us about 5 times. So 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, and so on for each hand up until your elbows. So let's just say that I've completed my sterile scrub. I come in. Now, the true thing is that they still show on the TV show is their arms up. So that is true, because I cannot touch anything now that my hands are sterile. So I come in, and I have my gown and gloves again. Inside my package, now that my hands are sterile, scrubbed, I can just touch the corners of this towel that's in here. And I can pick that up, and I can use that to dry my hands. And you want to dry from the fingertips down to your elbows. And then just drop that out of the way, just not back on your sterile field because that's considered dirty now. Now, this next part on the gown, I'll show you in just a second, it's folded in half. So I can touch my gown on the inner part, because this is the part that's going to touch my outfit, making it, after it touches me, not clean. So I will show it to you this way. There's a fold here, and then there's an opening where the gown will open here. So the fold, where it's folded, is going to be facing me. So this is how I can hold my gown on each side. And I don't know if you can see it all that well, but there's these little flaps in the gown where I can slide my hands in, and I can kind of grab my gown and I can use it to open it up, kind of like you're opening a book. So I have my gown ready to go. What I'm going to do is I'm going to make sure I have plenty of room to do this, is I'm going to back up and I'm going to open my gown and let it fall, but not letting it touch the floor, because if I do that, it becomes not sterile. And sterility is very important, as I had mentioned. So I'm going to put my arms through, and you'll also have somebody, your circulator or somebody else in the OR, who's going to come and tie your gown up. We have a lot of funny words in the OR, and tying up sounds a little different, but that's what it is. So we're just going to say that somebody came and tied me up. Now, everything right here from my waist up is sterile. Anything below my waist is considered not sterile. So, keeping my hands inside my gown, I can now take my gloves and touch them. This is still all sterile. Open my gloves. They're kind of folded in a little in fourths. I can open my gloves. Open them one more time. See? So now I have my gloves open. I'll show you as best as I can. See, like that. Left and right. I'm dominant right. So what I'm going to do, and this took a little bit of time for me to understand, is I can grab my glove. See, they're folded in half in a way, with the fingers down, and then there's this little area for the thumb, if you can see it, kind of. What I'm going to do, and this took me a while to figure out, is I'm doing a thumbs up, thumb to thumb, and I can tuck my finger underneath there. So, and flip it. It took me, like I said, took me forever to get this down. Now it's second nature. And I'm going to pull my glove on. So one glove is on. Makes it a lot easier now. With my two fingers, I can only touch the outer portion of this glove, because that's considered the sterile part. So see, I kind of tucked my fingers, I don't know, yeah, tucked my fingers in the kind of the lip. So now I can tuck this hand into this glove. And I can touch this glove, because sterile glove to sterile glove here. There, I have my sterile gloves on. The last part of sterilely gowning and gloving yourself is dancing. Yes, that's what I said, dancing. As you can see, I have this little string that's tied around my waist up in the front with this little card. I can pull the card out, I hand this to my circulator, and I do a nice little spin. And not doing it this way, obviously, but they hand this to me and I can tie myself up. So, being tied up again. So, obviously I didn't do this completely the right way, seeing as it's only me, but that's pretty much the concept on how to sterilely gown and glove yourself. Now you're ready to go jump into a procedure. Yay! Thank you so much. I hope you enjoyed my video.